I'm Dr. Arundhati Dasgupta and I'm an endocrinologist, a specialist of hormonal disorders. Today we'll be talking about the thyroid gland and its related disorders. The 25th of May every year is celebrated as World Thyroid Day. A day of the year is specifically marked out as a World Thyroid Day in order to increase awareness about the thyroid gland and its disorders amongst medical professionals and the general population. The thyroid gland is a very small gland located in the anterior part of the neck. It is shaped like a butterfly and is about the size of the terminal part of your thumb. But a gland that small has very strong implications in the body's metabolism. It secretes two hormones by the name of T3 and T4, and these two hormones play significant roles in various organs of the body and take care of various functions of the body. The thyroid gland basically is known as the manager of the body because it manages so many of the important vital functions of the body. Now, thyroid disorders can be variant. We can have hypothyroidism, in which the thyroid gland is unable to make sufficient amount of T3 and T4 hormones. Or we can have hyperthyroidism, in which case the thyroid gland is making excess of hormones than the body actually needs. We can have a goiter, which a lot of people know as the enlargement of the thyroid gland. We can have thyroid nodules. There can be thyroid cancers. There may be inflammation of the thyroid. So all of this, there is a myriad of manifestation of thyroid disorders. But of these, hypothyroidism and hyperthyroidism are the most common and is what we will be discussing next. So hypothyroidism, the situation in which the thyroid gland is unable to make the required amount of thyroid hormones. So in this case, what happens is that the general metabolism of the body slows down. And because of the slowing down of the metabolism, a lot of the normal functioning of a lot of organs are affected. The general manifestations of hypothyroidism may be tiredness, lethargy, hair fall, skin dryness, constipation, and then it can go on further to have strong implications. For example, it can cause menstrual irregularities, it can cause infertility, it can cause problems in the heart, in which case in extreme cases the heart becomes dilated, it is unable to perform its action adequately, the heart rate becomes slow. Then there can be problems related to children, in which case they are unable to concentrate, the growth of the child is affected, the child is not growing as well as he or she should. In elderly people, it can just present with a cardiac manifestation or it can present just with constipation, and then there can be other problems related to other organs also, which are rarer but then they can happen. In general, these are the problems associated. Then of course you have problems related to memory, to impaired consciousness, and in extreme cases, which is very very rare but it can happen, hypothyroidism can lead to a condition known as a myxedema coma, in which case the patient is really very very sick and needs to be hospitalized and treated. But then the diagnosis of hypothyroidism is very easy. It's just about getting a simple thyroid function test done. In our country, the statistics stand at around 1 in every 10, which means to say 1 person out of 10 people have hypothyroidism. And yet, because the clinical features are generally a little subtle in the initial part and they're generalized, people are unable to diagnose it and may remain undiagnosed for a very very long time. So therefore we need to keep a threshold of suspicion about thyroid disorders if anybody has these problems. Now the general concept is that if you're gaining weight, you test your thyroid hormones, but generally weight gain is not a problem which is very strongly associated with thyroid disorders. I mean you might gain a little bit of weight, 3-4 kgs, but generally it's not more than that. It's the bloated appearance. You tend to add on a little bit of fluid, you have a little bit of edema, your feet are swollen, as you press it you see that it gets kind of indented. So these are the signs which might lead you to think that you might have a thyroid disorder. The opposite part of the story, the hyperthyroidism, in which case just the opposite thing happens. The body is metabolizing faster than it should. So in which case you're having palpitation, there's tremor of the limbs, the person is losing weight, there is increased appetite, and in spite of that there is a lot of weight loss. There can be other manifestations like that you need to go to the bathroom more frequently. I mean you have a lot of intestinal problems because of that. The absorption is not proper, you're going to the bathroom again and again. And you can have problems with the eyes, in which case the eyes might become bigger because of certain roles that certain other antibodies not play behind the eyes. So eye might become bigger, it might become red, and so you might have seen thyroid patients who have these problems. You might get an enlargement of your thyroid gland, which might be slightly smaller, it might be a little more bigger. So you can have these problems with hyperthyroidism. Hyperthyroidism is less common as compared to hypothyroidism, but it can at times be very severe and can very strongly affect the quality of life of a person who has hyperthyroidism. In India, around 42 million people have thyroid-related disorders, and yet a lot of them are not being diagnosed because either they're not going to the right doctor, they're not getting the right tests done, or they're not getting treated correctly because, at times the treatment of thyroid can be complicated. So everybody out there who thinks that, I have any of these problems, do get your thyroid function test in time. It's a very simple blood test, and then go to your doctor. The treatment of hypothyroidism is very, very simple. It is just about taking in the thyroid hormone that the body is not making. But your doctor needs to decide at what dose you need to take. Usually people who have overt hypothyroidism, in which case the TSH, the test that is done, is usually a lot higher than the other, is a lot higher than what it should be. Then in that case the treatment is usually lifelong, but again your doctor will tell you which type of hypothyroidism you are and what kind of treatment you need. Hyperthyroidism, unlike hypothyroidism, usually has an end point. We usually reach a state where the body is in remittance, say after 1.5 years or 2 years, and then we have other options like surgery or radioactive iodine and others. But the concept of bringing forward this video to us is just to make you aware about the thyroid disorders, about the implications of the thyroid disorders, and how treatment is very, very much possible. It's very simple. In very simple terms, it's an easy treatment. It's not a complicated treatment, but then it needs to get diagnosed on time for the correct treatment to be done. Regarding thyroid nodules, if you palpate this area and if you see you're feeling some nodule or if you feel an enlargement, go to your doctor, because treatment needs to be done. We need to get an FNAC or an ultrasound to see what is the cause of that enlargement. There can be chances of thyroid cancer, of course, which is very rare, but again it can be there, so which needs to be diagnosed on time. It's very, very amenable to treatment, thyroid cancer is, but it needs to get diagnosed on time. Sometimes you might get severe pain in this area, which could be inflammation of the thyroid, which again has it has a certain course of treatment, in which after which it does subside. So if you have any of these problems which we just discussed, please contact your doctor, get your thyroid function test done, and get treated on time. Let us all be aware about thyroid gland and its disorders, so that we can make the necessary changes. We can make the necessary changes in our medications. We can make the necessary changes in our lifestyle, and accordingly treat the thyroid disorders as they